I'm Troy Beverly, and this is Pan-African News. Uganda. Ugandan nurse dies of Ebola virus in the capital, Kampala. Uganda announced on Thursday, January 30th, 2025, a death in the capital, Kampala, caused by Ebola. The 32-year-old male nurse who worked at the Mulago National Referral Hospital had sought treatment from several hospitals, including Mulago, after catching a fever. As reported by The Independent, Permanent Secretary of the Health Ministry, Diane Atwine, quote, "The patient presented with a 5-day history of high fever, chest pain, and difficulty breathing, which later progressed to unexplained bleeding from multiple body sites," unquote. According to Reuters, the patient died of multi-organ failure at Mulago Hospital on Wednesday. Post-mortem tests revealed that he died of the Sudan strain of Ebola, for which there is no licensed vaccine. The health ministry will be offering experimental vaccines for the Sudan strain of Ebola to contacts of the patient immediately. As mentioned by Radio Tamazuj, the patient recently had contact with over 40 people, including 30 health workers and patients at Mulago Hospital. But no one at Mulago Hospital, healthcare worker or patient, has shown signs of Ebola. Atwine said that the health ministry's rapid response teams are fully deployed, contact tracing is underway, and that everything is under control. But containing an Ebola outbreak in Kampala, with a population of 4 million, is easier said than done. As stated by AP, Emmanuel Batibwe, a physician who helped lead Uganda's containment of Ebola during the 2022 outbreak, believes the country is prepared to effectively react to the current outbreak quickly. The first documented case of Ebola was in 1976 in a community near the Ebola River in Zaire, modern-day Democratic Republic of Congo. The Sudan strain of Ebola occurred in neighboring Sudan the same year. There have been 7 previous outbreaks of Ebola in Uganda, with the most recent one occurring between September 2021 and January 2022, during which 164 cases and 55 deaths were reported. Symptoms include fever, vomiting, diarrhea, muscle pain, and in severe cases, internal and external bleeding. The Sudan Ebola strain has a fatality rate between 41 and 100%. Scientists believe Ebola is transmitted by an infected bat, porcupine, non-human primate, etc., encountered by a human or whose raw meat was eaten by a human. The World Health Organization will send a $1 million allocation in support of Uganda's effort to contain Ebola.